Okay, great. Good afternoon, everybody. I'm Paolo Ciuccarelli. I'm the founding director of the Center for Design that is hosting this Design Research Week. It's the third edition. We started in 2022 for a number of reasons. First of all, there are plenty of design weeks happening around the world, and it's growing. I counted 40 that are part of an association that is also like design weeks. But what they do usually is that promote an idea of design that is mostly linked, to the product, production, consumption, and all design in like a more commercial sense. So we wanted to contrast that with an idea of design and creative practices more general as the research drivers, research catalysts for innovation, especially when it comes to social relevant challenges. And sometimes people have this idea of design that is like a blurred, non-linear, messy process. So we wanted also to contrast this idea with a more rigorous approach to design as a research process. And last but not least, we believe that is that without an centered new Maine, I would say, disciplines, there is no chance that we can really face the challenges that we have at hand nowadays. The more complex they become or they are, I think we need to complement science with other disciplines that can help understand human needs and respond to what's coming. So this is more or less what brought us with this idea of the Design Research Week, celebrating all these values, inviting as many people as possible within the university and outside, and partner with people that kind of share the same values. So this year, the week really spans across 7 days. It's the first time that we cover the entire week. So we start today. It's mostly about healthcare and well-being. Tomorrow will be creativity and play, game design involved. Wednesday is about design for communities or design with communities and civic futures. Thursday is all about data and AI, part of design. So we have a little angle on music and design with data and algorithms involved. Friday is about form and materials, like the materiality of the design process. And then we have these 2 extra days, and one is to celebrate an exhibition that is happening in Thailand and Providence that is led and organized by a colleague of ours, Menendez Lopez, that is really, it put together a show that is amazing about Latin graphic design. And it's really, if you have time on Saturday, go visit that exhibition. And on Sunday, we have this Scout conference. Is every year, Scout, this studio led by students here in Candy and Northeastern, organizing this conference that is usually a very important moment for us to reflect on important topics. And this year, the title is Interventions Shift. That's the kind of an overview of the week. A couple of highlights. On Thursday, we have this panel with faculty joining from other universities discussing how AI is entering the field. So how AI is changing the way you design and the way you learn about design. So I think it might be very interesting for both students and faculty to gather and discuss about these topics. Nathan and Yuga, faculty of Northeastern County. Jody Police is coming from County Mellon, joining online, and Eric and Kyle also online from Berkeley. And Bergen and Kelly Zhang is from Reading. So, and she's joining in person. So we have enough people in person and online discussing about this new actor that we have to play with in our processes. And another, this is kind of a new format. So we created this award last year to celebrate excellence in a field that had no awards before, that is data sonification, so the transformation of data into sound. And we will announce the winners or the awardees Thursday. And in the evening, we organize a concert. So we perform all the awarded projects in a venue that is part of the Center for Astrophysics at Harvard. It's free, of course. So if you want to join 5:30, we will have this unique experience of, playing all these what projects that got the data certification award. Couple of highlights, but if you want to check the full process program is online. There's a QR code around it. And yeah, we couldn't done any of that without all our partners. So people that just again shared what the idea that we had and helped us delivering all the content of this week. So thank to all of them and thank you for joining today. This is just the beginning. That is yours. Nice. Nice. Thank you. There.
Yes.
You're leaving it off, yeah.
I usually should just use your computer.
Oh, sure, or I can push the button.
That's okay. I don't have to ask you that. Oh, no. I can leave for the thing. Oh, good, the notes are ready. Hi, everybody. My name is Sarah Jensen Carr, and I'm leading the team today. I'm going to let us all introduce ourselves momentarily, but our presentation today is called Bridging Gaps, Co-Creating Access, an interdisciplinary approach to improving rural healthcare in Maine. And I also want to recognize the generosity of Center for Design. We are with the Health and Wellness Design Lab in this work, and especially the Tier 1 program here at Northeastern University, which has supported most of the work that you will see here today. So our research goal, and you're going to see a number of projects here that are all tied together, is to identify, design, prototype, and evaluate innovative models of rural healthcare through a community engaged approach in a very close partnership and a really fruitful partnership with a nonprofit clinic in Knox County, Maine. And so today we're going to cover sort of the origins of our partnership and the overview of this project, the environmental design approach, communications approach, systems and service design approach, the incredible work that Scout Labs has done with us so far. And then finally, just some takeaways and discussions, and we'd love to hear your questions as well. So just to introduce your team, I'll just introduce myself a little bit more first. So I'm Sarah Carr. I'm an associate professor in the School of Architecture and co-founder of the Health and Wellness Design Lab. And a lot of my research focuses on health and the built environment. And I will throw it to our colleague on Zoom, Kathy Simmonds, to introduce yourself.
Hi, everybody. Wish I was there in person. I'm Kathy Simmonds. I'm the clinical professor in the School of Nursing, Bouvé College of Health Sciences, but my location is actually at the Roux Institute in Portland, Maine. I'm the associate director of health programs here. So I'll be talking a little bit about some of the background.
Michael Arnold Mages, also one of the co-founders of the Health and Wellness Design Lab, assistant professor here in design and Center for Design for faculty. And I've been working on the service and strategic design components of the Knox collaboration. Oh. I was going to throw it to Steph, but
Okay. Or you can.
or
All right.
yeah.
So
Sorry. No hard feelings.
I'm the associate director here at the Center for Design. Also, have been collaborating with Michael, Sue, Sara, in the past couple of years. Now with Kathy as well. So excited to be a part of this project and collaboration. Also, a lot of the work that I do is in the service design space, experience design space, specifically in healthcare. And I also am the faculty advisor for Scout Labs. So then I'll pass it on to Shannon.
Yeah, I'm Shannon Haley. I'm an MS Experience Design student. And I've been working on the Scout Labs project for a few semesters now. We've been working on the Knox stuff.
And we have one fallen comrade, unfortunately, to the flu, but I just want to recognize the contributions of Susan Mello as well, who's an associate professor in the Department of Communication Studies and also a member of our Health and Wellness Design Lab. And so with that, I'm going to throw it to Kathy to talk about the origins of our partnership with Bouvé, but also our partnership with Knox.
So for people who are not familiar with Maine, we have we're extremely rural state, and the way that that gets designated depends on which measure you use, but the entire state is considered rural. Knox County is a rural designated county. The Roux Institute is actually located in Portland, and Cumberland is one of the few counties that is not thoroughly rural. But as part of my work at the Roux Institute, I am charged with developing rural health initiatives. And so the Knox Clinic, which has been a free clinic serving underserved populations in Knox County for 25 years, established a relationship early on with the Roux Institute around something that is called our Gap Year program. I'm not going to talk about that, but as community engagement goes, it quickly turned into many other types of projects and collaborative initiatives. So next slide, I'll tell you a little bit more about Knox County specifically. So in addition to being one of the more rural counties in the state and the nation, it is also the county with the second oldest mean population. So Maine is the oldest state, meaning we have the oldest population in the country, and also Knox County is an older population even within the state of Maine. Maine is also an extremely white state. And, you know, while the coast is an interesting area, and particularly Knox County, because we have a lot of people who decide to buy a second home, settle there, spend their retirement, there's also quite a bit of poverty. And this is a truism across rural communities across the United States. But even in Knox County, we have quite a few people who are working families, people who've settled in their retirement years, but actually have a very low fixed income. So about 10% are at or below poverty level, but that really doesn't reflect the true disparity that exists in the county. We also have a high level of childhood poverty as well. And so I'll talk about all of those a little bit more. Next slide, please. So part of our experience in working with the Knox Clinic has really been around a community participatory engagement relationship. And so the first pillar of that is really just the relationship building. And we've done many trips up to Knox County, to visit the Knox Clinic, and worked with the clinic on site. They also have come down to the Roux Institute for a number of events. And a lot of that work can really be characterized along the way as just accompanying. This clinic, when we first partnered, they were essentially squatters in a building that is owned by the largest health system in the state called Maine Health. And actually, in the last 2 years since we've established the relationship, Maine Health left the building, which left it up for sale, and the clinic was able to purchase the building. So they're in a rapid expansion of their service delivery through ownership of their own brick and mortar clinic, which was not their plan when we met them. They were planning to expand, but to do it through building their own clinic. Secondarily, they also had decided they would apply for federally qualified health center status, which is a national designation, and that came upon them much more rapidly than they had been anticipating. So the accompanying is really just to note how important it is to just walk the journey when you're engaged in a community relationship with a partner, and that it doesn't always go exactly how you're planning. Showing up means going both virtually, we do meet often on Zoom and other ways, but also just sometimes showing up for important events. And then really engaging in a transparent, questioning, reflecting relationship. So we have spent time with them in meetings and workshops, really asking some deep questions about their mission and values, really trying to share why the Roux Institute and Northeastern are interested in being involved in this relationship. And then harnessing resources, which is everything from the faculty and student talent that we have, including in CAMD, but also beyond at Northeastern. And all of that feeds back into the relationship. Next slide, please. So the important work that we began with, in addition to the gap year program, really centered around a mobile health bus, which Northeastern University, some of you may be familiar with their health and wellness bus that they had that had been serving urban communities around Boston. It was really championed by the School of Nursing, and in 2022, the spring of or 2023, Northeastern had decided to sunset that mobile health unit at the same time that we were beginning to develop a relationship with the Knox Clinic, and they were considering expanding. So we were able to arrange for the mobile health clinic to be donated or gifted to the Knox Clinic through that process. And that's been a really interesting journey, with lots of ups and downs that I think others will talk about as we get more into the design. So next slide, please. Literally, part of the work of gifting the mobile health bus was removing the old wrap and also assisting with the design of the new exterior, as well as engaging in a refurbishment of the interior. So all of that has been a really important part of the work that students and faculty alike have been involved in collaboration with the Knox Clinic staff and volunteers. Next slide. And we have other engagements in the county as well that really the Knox Clinic has helped to introduce us to some of the other community stakeholders, including the town of Thomaston, which has been involved in a redesign of the Thomaston Green. We've developed a relationship with the local hospital, which is called Penn Bay. So really the Knox Clinic is at the hub of a certain social network that we are now integrated into as a result of our original relationship with them. Next slide. And some of our work, as we mentioned at the very beginning, has really been in the area of research. With our Tier 1 grant, we've been able to support some of the refurbishment of the clinic, but also the mobile health unit, but also now are engaged in helping with the design around the entire brick and mortar clinic, as well as helping with service delivery blueprints, and then helping to rally forces to be able to get funding from other grants outside of the Knox Clinic itself and Northeastern. And so I'm going to turn it to my colleagues from CAMD, because everybody is involved in the distinct parts of the project that I think are really relevant to Design Week. But just some of the things that we're looking into and helping to the Knox Clinic to think about are how mobile healthcare units are utilized in the field. So we've been doing research outside of Knox County, outside of the Knox Clinic, and really looking at models that we've engaged stakeholders from other healthcare delivery organizations across the country, including interviews and review of the literature, but also engaging the community stakeholders that I mentioned in Knox County. So some of the organizations and people that the mobile health unit and the clinic itself will be serving, and then redesigning the whole program based on the inputs that we're receiving from our community stakeholder and literature reviews. So I will turn it over to the next presenter.
Hey, so as I said, we've sort of talked about all the design research inherent in this project across really, I mean, almost all of the departments that we offer here in CAMD. And so I'm going to start with the environmental design approach. So my own background, actually, before I came back to academia, was in healthcare design, mostly doing hospitals and clinics. And that's initially actually how Kathy and I came together, because we're both fellows at the Institute for Health Equity and Social Justice Research here on campus. And I talked about this background, and she said, well, I'm working with this clinic and we have this ban. Like, what would you think about, designs around it? And it really grew into this wider design project that also, encompasses spatial analysis, which Shannon's going to talk a little bit about. At that time, we thought the clinic was going to build a new clinic from the ground up and in a park. So that's actually how I initially came to this, was thinking about how to do long range planning and thinking about that park as a healthcare infrastructure in of itself. But it did start with the band, and that's sort of the most immediate part. And so really, I think you'll hear again, especially working with a community partner, we had to think about what are some simple upgrades we can do to make the van more welcoming. If you saw some of those interior photos, it's still pretty grim inside. And so we wanted to kind of refurbish it in a way that was more welcoming and could also offer a variety of services. So really the first stage, which is what we're working on right now, is just replacing flooring, replacing countertops, new lighting, some branding, but really just to make it a welcoming and flexible space for a low cost. This is some of the work from Scout Labs done earlier on, specifically Betsy Schweffler and Anna Van Kuhn worked on this. But really what Knox wanted, because what they saw was a need in the county, was one, not just primary care, but also sort of an expanded waiting room, which is just the piece in the middle of the van. But they're seeing a really large need in the county for mental health services, which are not as easily accessible. And so they asked us to come up with a scheme to turn one of the exam rooms into a therapy room. And with the other one, we're thinking about it, as a flexible space to also offer dental services, something as simple as dental cleaning, the importance of dentistry I'll get into in a moment when we talked about the clinic itself, and hopefully in the future screenings as well. But we were thinking about this as sort of a parallel research and design project, where as we came to understand what the health needs are in the county and where the van would go, that we would sort of redesign and refurbish the van in real time. So it's been a really interesting problem from an environmental design aspect. And so as I mentioned, when I first came on the project, they were going to build a clinic from the ground up, and I was sort of advising on programming. And then midway through the project, they actually bought this building instead, which, at that time, they were really running out of just a couple rooms there. But they were sort of tenants, but they ended up buying the whole building. And then we started to work with the clinic to really understand their operations, or how a person might come into the clinic and where else they might go. And so in consultation with them, and also thinking about their long-range plan, which Michael's going to talk about, and that's something I would stress for all of you, is you will see how all of these are intertwined and have really counted on, very free-flowing information between all the groups involved. And so the challenge here was, how can we kind of reconfigure the spaces, or what we call program the spaces, to provide all these services, from group therapy to lab to exam rooms to behavioral health, to offices, right, for the staff. We also have to think about staff health and staff space, and the various phases that they were planning. And so what you see on the right here is we're just looking at sort of projected office space. We talked to them about their areas under construction. So right now, actually, most of Knox Clinic's services are in the dental clinic. They service almost 1,000 patients in their dental clinic, and that's because they're one of the really only entities there that take Medicaid for dental offices. However, what's really interesting in primary care, especially in underserved counties, is that dental care is often the gateway to recognize larger health problems. And so really the challenge here was to think about how different people might come into the office, and how, I love the term that the Knox Clinic used, is what's the, I think it's the gentle handoff, right? Or a gentle transition. If you sense a patient you need that needs social services, behavioral health services, primary care, how can you humanely move them around the building to make sure that they get all the care that they need? And so these are some of the phases, also after talking with them about construction and thinking about how people might move around the building. And hopefully, at some point we will get to this, which is the grant plan, which is dental on one space and lots of exam rooms, including pediatric rooms, even a psychiatric nurse, and a pharmacy on the first floor. So for this, I'm going to do my best to represent Susan's part, even though I am not a communication studies professor. But really, you'll see how the communication goes hand in hand with the environmental design. So the communication team had 3 objectives: to design a sustainable new wrap for the van, to support a redesign of their website, and to create a strategic communication plan for the clinic's ongoing expansion, as I said, as they were expanding their services. So this work was done with a CAMD student in the Dean's Honors Fellowship Program to assist with the initial mock-ups. And the priority here was to create a visually appealing mobile billboard for the clinic. So the van in of itself becomes a mode of communication, but also keeping current and future costs as low as possible. So we're always forward thinking all of this. How do we keep the cost down for the community partner? They did audits of the Knox brand as well as of the other mobile clinics, work through various concepts with the Knox staff, talk to a local printing shop to understand what was feasible. And this is probably like our biggest success of the year so far. Is not only stripping the wrap, but also putting this new branding on. So simple, bright, consistent branding spreads awareness of the multiple ways to connect with Knox through QR codes and also the website and telephone numbers on the back. And even though they haven't been providing services in the bin yet, while it is being refurbished, what they do is they've been setting up some vaccine clinics with just a sense of the background, right? And so it lets people know that this is going to be another mode of delivery soon. Thanks to CAMD's undergraduate research opportunity program, we were also able to recruit another student from communication studies, James Ryan, to support the redesign of the Knox website. And he conducted a SWOT analysis of the website in comparison to 8 competitors in the surrounding areas. And so while there were several strengths very tailored to the community, they saw that there were also opportunities for building out their content and streamlining navigation. So these are some of the first steps, introducing you to the team, very people touch, thinking about who will be in there, being very clear about what kind of services that they offer too, which are numerous. And finally, we've been working with the communication director to develop a strategic communication plan using insights from a recent community survey. We've established several SMART objectives to grow their medical patient population this year. And really, as we talked, services that they need. And this plan also includes messages informed by health communication theory and research. I hand it over to the.
It's so it's so just to think like, oh wow, all that happened
Yeah.
in one semester, really. This sequence of work culminated in a trip where that photograph from the previous slide, I think, was taken, where we all went up to the Knox clinic, and we were able to spend a really good afternoon working together with them to think through some of the strategic implications of the growth of the clinic. As Sara mentioned early on in the presentation, one of the real challenges for an organization is when the environment around it changes suddenly. And you can see that happening, with the current political transition. A lot of universities are feeling maybe some stress there, maybe some of you are feeling some stress. But another real key point that creates a vulnerability for an organization is when the organization itself is undergoing transition. And this could be, a transition where there's a downturn in sales or a change in the demographics that's using the service, but it can also be a positive change. So this great opportunity for them to build this new building, to renovate this existing building into what they want, is a real point of fragility for an organization. So we were able to spend a day with them and talk through some of those points. One of our PhD students, there we go, Maria Fernanda Ramirez Cifuentes, did some background research and developed this business model canvas that we were able to use to organize the conversation throughout the day and develop a set of outcomes, markers, and strategic goals that we're looking at developing throughout the day. Some of the things that emerged from that was this posture of the clinic as a provider of holistic care. Sara pointed to some of that earlier, but just, to talk about some of the specificities of what goes on in the Knox. At their dentist office, there's a bookcase just sitting there in the hallway that has masks, toothpaste, vitamins, pregnancy vitamins,
General medication.
general medications, yeah, aspirin, the shot
Narcan.
Narcan,
Yeah.
that is just free to anybody who comes in the clinic. So, not only these things aren't just like, like thinking that we're here to provide holistic care to people and saying that in an abstract way, is nice, but that is really where, one of the principles that drives their day-to-day operations. And so noticing that, being able to verbalize that, and then thinking about where else within the organization can we design in opportunities for holistic care. The second one, models of care, again, this is driven from some of their description of themselves, more focused on providing wellness than fixing people's diseases. So rather than looking at a patient who comes in from a perspective of what's wrong with you, and let's shine some lights and like thinking of like, how can we bring a greater degree of wellness to your life? So again, like as Sara was saying, thinking about how people move around the clinic is more than just, well, now you have to go down and get blood drawn. But it's like also an opportunity to see the other services that the clinic provides, that, oh, there's counseling here too. Oh, there's a dental office. Oh, there's also, I could get vaccines. I had, and pediatrics. That's a whole nother thing that I won't talk about, but I don't think we'll talk about in this presentation, but really critical for a place like Knox, where they're in a county that's transitioning to this older population. And again, this idea that they're more than just a healthcare provider, that they're out there proactively approaching healing people in a holistic way. Looking at those social determinants of health, where people live, and actively trying to lower the barriers to care. I think one of the challenges, that we found in our initial research, and I think some of the guys in the room too were part of that, missed appointments in the dental clinic as indicative of the challenges of living in one of these rural areas. So some people are like 11 miles down a dirt road, where there's only one road that leads out of the particular area that they live in. And maybe they don't have a car that's reliable. So those kinds of things surface, come to the surface when working with a partner like this. Some of the strategic insights that we developed from this, what is the kind of core audience for the Knox Clinic? And I know this is you probably heard this phrase before, but underserved populations. And then the question is, well, why are these folks underserved? And this is it's a complex network of factors, including the level of insurance that they might carry, whether they're hesitant to seek care because of prior bad experiences with care, trauma survivors, and folks facing addiction and recovery are key groups to connect with. We also found that there was a great opportunity to establish a broader network of community partners, as well as help define what the expansion plans are for the clinic. And this is sort of dovetails with the groups of community partners, where they're lacking services in this community, and where does the Knox Clinic have a unique opportunity to provide these. going to hand it over to Shannon to talk about some of the service design work that the Scout team did. But just, there's a bunch of students in the room and I can't quite resist the urge to teach a little bit, just a little bit. So some of you guys may or may not be familiar with service design, but the opportunity, am I running over time? Oh, I'll talk way too long if I don't. But service design, uses a lot of maps and diagrams and timelines to structure, to show the structure of how a service might progress. Why do you do these? You do these to clarify complexity within an organization. You do this to help improve coordination between different groups within an organization. You do this to help identify gaps in service provision. Where might there be a part of the service that isn't quite meeting the need? I'm sure we've all had those experiences where you sit on hold, trying to talk to the technical support person and you're on hold for 30 minutes. That I would call a gap or a bottleneck in service. And to enhance the experience of patients who are using the clinics. So thinking through the service provisioning can help direct resources to where resources need to be used. And especially in a clinic like Knox, where there's just the core executive team is really 3 people. The healthcare staff can be counted in less than 20. And they're really providing service to over thousands of people on a yearly basis. It's critical with these organizations that are operating in this area to really be mindful of service design, service provisioning, so you really get the maximum bang for the buck, the colloquial way to talk about it. With that, just a little bit of framing there, I'll pass it over to Shannon to talk about Scout Labs.
So yeah, the Scout team has been working on this project for the past 3 semesters now. And Scout is a student-led design studio here at Northeastern, and specifically the labs team works on like civic and community-based projects. So we've been researching mobile health, like mobile health care, and we've been interviewing and distributing surveys to existing mobile health clinics around Boston area and the US to understand mobile health care and how to best support the Knox clinic. We also been designing service blueprints and journey maps to optimize clinic workflow and patient experience. And yeah, we've also been mapping out the specific where services should be provided within Knox County. And also potential community partners within the county as well. And so there's kind of like a snapshot of our different research areas. And we've also had the Scout team working on the interior design of the van as well. Here's our team for this semester. Here's a look at some of our approach and methods. We've done like stakeholder mapping, data visualization, behavioral mapping. We've also had the opportunity to travel around Knox County and look at possible locations that the van could go within the county. So yeah, we've done kind of like an analysis of different locations. And we've also done some patient journey mapping of the clinic as well. Yeah, so going back into service blueprints, we've been mapping out specifically for the van, the service blueprints for 3 different types of services right now. So we're looking at like vaccinations specifically at schools. We're also hoping to look into primary care services at senior centers, and then behavioral health. When we were trying to think of a 3rd location to kind of focus on, and we decided on libraries. But yeah, we're really trying to think of what services the van is most important for it to offer, but also where should those services be deployed specifically, and what community partners the van could work with. Also, another one of our deliverables is a health risks and community asset map. We're building this within ArcGIS, and so this is showing a lot of public health data of the county, as well as the locations of possible community partners. And we're just kind of overlay all that data to kind of figure out where the van should go. So right now we're looking at, we're creating a health risks index, and we're looking at a bunch of different like economic, social, health, and more like built environment data. We're taking data from like the US Census and the CDC policy map. We're also working with a community survey distributed by the Knox Clinic within the county. So yeah, that's kind of the status of that now. And yeah, really the next steps for the Scout Labs team, we're going to continue building out this community asset map and health risk map, do some usability testing with health professionals, as well as expand those service blueprints and patient journey maps to cover those services that the Knox Clinic hopes to provide. Yeah, that's what we are working on. So off to Sarah. Yeah.
For a minute, there's a QR code. If you find yourselves interested in these topics of rural health, I just wanted to quickly plug. We're actually hosting what's called an idea jam at the Roux Institute, so interdisciplinary teams of students. We will have presenters from some of our partners this semester, folks from the Maine Mobile Health Program, which provides mobile health to migrant workers in Maine as well. And so, you know, this has been, I think many of us are very familiar with issues of urban health. Like thinking about rural health this year has been a real way to expand our thinking around, especially around design issues. So much thanks to Kathy too, for bringing this in and, you know, really being the expert in this arena. So please register. You can also ask Steph for the link afterwards. $500 cash prize for the winning team.
I don't know if it's too small, but it's next Friday, not this one, but the 28th.
Yeah, March 28th, 10 days from now. Also, we still have slots left. The first 30 students from Bouvé that sign up, you get your travel reimbursed. So it's a very easy Amtrak trip from North Station, $22 each way, but we've timed it to the train schedule even. So you can be out of Portland and back down in a day. So this is mostly a student group, so I would actually love to hear your questions first. This is actually, I think this is the first time we presented this work so holistically across all our fields. And so just know that these are thoughts like I mainly wrote down after, and I'd love to hear from my team. The things I was thinking about is, you know, how we've been working on this in a lot of discrete pieces around the Knox, but you can see how design enters in a lot of different arenas while still trying to keep our holistic goals in mind, right? And that's really like, what is a blueprint for rural health? How can clinics and other rural and how do we return to the research question? How has it changed over the course of the year? That's actually a discussion we should have as a team soon. Too, and I think actually these go hand in hand. You know, there's the value and challenge of community engaged research. As I mentioned, you know, when you're working with a key partner, it's not always on your timeline. We have a grant for a year, right? So that's something we're working up against. But as you can see, sort of the goals and the needs of the clinic really changed very quickly. So what is the line between design services, which we're all kind of drawing from our own, I think, professional backgrounds as well now our academic interests, about how do we return this to a research question? One of the most gratifying parts of this project is experiential learning. Shannon, I hope you agree. Experiential learning for the students. We've involved a lot of students. You see a lot of student work here. And I know every time we brought students up to Knox County, up to Portland, it seems like it was a very rich experience, and we got so much. We've benefited so much from the enthusiasm of CAMD and Bouvé students over the course of this. And then last, and I think we're all thinking about this, is thinking about shifting goals. Right now, health equity research is in a very hostile federal funding context. I mean, to the point where, you know, this clinic sort of seemed like a slam dunk to become a federally qualified health care center in the next year. That would have really solidified their business model. We don't know now, you know, what the status of Department of Health and Human Services, National Institute of Health, all of it is going to be. So I think, as we continue to work with the clinic and, we're very committed to having them as a long-term partner, but, these are all challenges.
Well, and what that means, that federally qualified health center status means is that the Knox Clinic would be able to actually bill in health insurance. Because right now they're only, I think the only way is direct payment for Medicare and Medicaid. And so because they're committed to keeping like low cost healthcare, I think the visits are like $40 for an office visit is the cost if you're like, if you don't have another means of pay. That becoming that federally qualified health center would have allowed them to bill insurance for the costs of visiting, for the cost of providing care, which, radically changes the, the amount of money that they have to offer this. So in the past, the clinic services have all been to a greater or lesser degree provided by volunteers. So some of the doctors that are working there have been volunteering for that clinic for what, like 20, 30, 40 years, giving, coming in after work and giving free care to people who are in the community. So
Many of the board members also provide health services.
Yeah. So when you're talking about, well, we'll just cut some of this some of these federal employees, we don't need them, they're extra. Well, these are the people that are, that help organizations like this be able to, have the infrastructure.
lights on.
Yeah, keep the lights on and build the, and come back to the, keep the lights on, I guess is the best way to say it concisely. Thanks.
It's just a real reality for these, Knox Clinic has bootstrapped their way, and they had such hope that the federally qualified health center status, it also gives them a bolus of money at the beginning of every fiscal year that would really help them, with all the operating costs. So it's quite devastating to potentially not be getting that funding.
Sorry to end on a downer. But I think one of the things too that this work does is also shows that, like so much of the work we do in school is focused on the stuff, right? Like we're going to design this logo, or we're going to design this brochure, or we'll design this space plan, we'll design this. But really what we're working on by proxy, by designing that, those things, is designing a network of social relationships where people can help other people do the kinds of things they want to do. And I think that really highlights what this Knox project is all about, at least for me and for us sitting up here. And
That's a better ending.
Yes. I think just to add one more thing, like on the positive side, the beauty of this is that you may have seen like the multiplicity of approaches coming together into this challenging space. Now, and so I think we've seen from different areas and the collaboration across different faculties, student organizations, student groups, students themselves. So I think that's the beauty that I love about this project. And yeah, I mean, if it's okay, we can open it up for any questions or thoughts that you guys might have here in person or online. Yeah. Yeah, well, thank you so much.
Thanks, Sara.
Yeah, go ahead.
There's not much people not very like skepticism on how to be done in like their city. Like how do they feel about it? Like brought up to them.
Yeah, that's a good question. In terms of the surveys, you mean, or?
Guys do in like then I don't know like.
So when we went to the Knox clinic, mainly we've been working with the actual from the clinic, so like the employees or like volunteers that work at the clinic. Is that the question?
Maybe it was more so about like the patients and how they feel about this being done, like were there any like positive they could see or maybe like skepticism about this sort of service being provided?
I don't know, Kathy, if you heard that, but,
Can you say it again? Because
Oh,
I
just
can't
repeat
hear
that.
all of it.
Yeah, yeah, she was asking about, and please slap me if I get this wrong. She was asking about like, what's the kind of community response to the work? And she was wondering, you know, is it positive? Is there some skepticism? Where, yeah, and then I think there was also a second question in there about like, what kind of preliminary research was done to lay the groundwork for the set of changes that the Knox is going through right now.
Yeah. Two great questions. I think overall, I would say we have been received with really great enthusiasm for two reasons. One is Knox County has no academic institutions. And so really this idea of like a pipeline of people that are interested in learning and potentially working there someday and has been really well received. And second, it's, as I mentioned, it's a really old community. And so people are excited to see younger faces coming in with energy and ideas and enthusiasm. And so I would say just the basic kind of receptivity has been really high. And I think there's a smidge of skepticism, right? And I think this is true of any community engaged participatory relationship building, is needing to have that transparency about like, why are we here? What are we getting out of it? And needing to move really slowly in our, you know, in our asks of them, and making sure that we're doing it in a way that is again transparent. And then the second question was, what groundwork did we do? I mean, you know, I think we're all learning about rural health in a whole different way. Maine has a couple of existing community health needs assessments, you know, that are sort of seminal documents for understanding what some of the challenging health issues are in the state. So, you know, I would just say this is a rule of thumb, like find out what's already been done. And I think we did due diligence around finding out what's already being done in the state. You know, what's being done around mobile health programs. And then, you know, I think Sara and I think the rest of the team, like we all have career experiences. I've worked in community health for a long time. So we bring that piece of like, we're not naive to the challenges of community organizations that are working on behalf of underserved populations. Happy for anybody else to add.
Great question.
Yeah.
So I'm part of an organization that works a lot with telehealth specifically. And as you can probably imagine, a lot of what we're attracting is mostly an urban audience. People that have access to the internet or like some sort of space where they can get access to a computer. I'm curious as to whether or not technology was considered for Knox Clinic. So like using teletherapy, you can use like telehealth for an initial screening for bringing them into the clinic, et cetera. What were some of the challenges you encountered in the rural setting?
Oh, this is probably another good one for Kathy.
I can answer that. Yeah.
Did you hear that?
I did. I could hear that one. Yes, they have done some telehealth, mostly in rural Maine. A lot of the uptake has been around behavioral health. And one of the things that we've been interested in doing in our redesign of the clinic is actually building in sort of hotspot capacity, so that in fact, and the libraries in Maine have been operating this way already, they can become a hub for people who don't have home internet access. Because it's not just broadband, it's also the ability to afford the service plan, which again, when you're working with poor communities, that can sometimes make it out of reach. So you've got that double whammy. The third double, or the third whammy, is an older population. So again, like, you know, the digital divide includes economic factors, infrastructure factors, and also comfortability with using technologies. So there's a elderly man, 104 years old, living independently in Owl's Head, Maine, who telehealth may not be that he's used to going to the doctor, right? You know, like you go to the doctor to see them in person, maybe a house call, but telehealth might be something that's sort of out of reach. So thinking about telehealth patient navigators, like is there somebody who can go to the home, set up the call, all of the pieces that go into that. But it's definitely on the radar of Knox Clinic and on the radar of everybody thinking about the van and how to rig out the van to be the most inclusive and expansive in use of technology.
Well, I think part of that, like thinking about the van as a hotspot, also came out too of like the very practical question of like, how do we get people's medical records when they come to this van? And like some of these spots have lots of tall trees. Some of these spots are pretty remote. I don't know if I'm not gonna go back to the map, but the edge of Knox County has these 3 long fingers of land that stick out into the ocean that are like between like 11 and 17 miles long. And so and there's one road that goes up the middle of the finger, you know, so when Kathy said it's a rural county, there's spots that are over 100 miles from a highway. You know, it's pretty dang rural. That question of like, can we get connectivity if we drive 11 miles out one of these peninsulas? It, you know, like it kind of unpacks into lots of questions like, well, what possible benefits can we bring when we're out there with connectivity 11 miles out with a group of people that may have low mobility? And so I think, you know, that telehealth component is a real key question to be answered for them, especially in the realm of behavioral health. It's just great opportunities for that behavioral health, depression, feelings of isolation. I think all these can see positive, real positive impact. Let's connect later. Run your solution in Knox County.
Yeah, and there's one. Yeah, go ahead. And there's one more in the chat, Michael.
Could you guys talk a bit about the community engaged research? Like, were there any interesting twists or like unexpected insights from that research?
Want me to take that one, or somebody in the room?
Maybe Shannon go first and then.
Yeah.
Let me think about that for a second, Kathy. You can.
Well, I would go back to the little diagram I showed in the beginning of, you know, part of it has been staying nimble and flexible around our own research goals. For us, luckily, part of our tier 1 funding was in fact a very open kind of, we will engage with the community. And so back to like, a lot of it has been about relationship building, showing up, listening to them, using the resources that they've already developed, right? So, or the guiding tools. So they did, in fact, I was just responding to somebody in the chat about this. They did a barriers to care survey in the community in 2021. So we've been relying on that a fair amount to inform our work forward, where they engaged the community. They went out in front of grocery stores and you know, libraries and places in the county to engage people, to ask, which gave them the impetus for their expansion of the clinic, you know. And so really so far it's just building on what they've already gotten from the community. We're just beginning to engage stakeholders outside of the clinic around the clinic itself. So it's sort of a to be continued story. But I think, you know, frequent communication with the clinic staff and volunteers, which is a community unto itself. And now we're expanding out. So there's not an end to the story yet, except continuing to partner.
I think if I may add too, and I think maybe it links to the previous question, is like, working closely with the community organizations that already exist. They are the ones that are more attuned to the community itself, right? And that's what we need to work with as we collaborate and move this project forward. Because we've done it for another project also in here in Boston. So it relates to your question and the previous question about the skepticism of the population and the people. So it's like constant communication, and I don't want to say proving our worth, but like, what are we bringing to the table and how might we help them help the community better? I think, and it's establishing that kind of relationship.
Yeah.
The only thing during a research project with a community partner like this, one of the things that really helps is thinking about like what kind of research activities are they already doing as part of their day-to-day processes. Because like I said earlier, their executive team is 3 people, their healthcare team is like less than 20. They just don't have a lot of capacity to add like a new layer of, if they were to get another executive team member, that would be huge, like that's a huge impact to them. So doing things like there's a woman, Jessie, who's kind of their communications director, sort of social worker, but not really. She does a lot of that kind of like glue communication. So she's like testing these ideas out, talking to people in the community, and it's kind of like a continuous flow of incoming data. Although, like if we went to any data-driven project in Northeastern, they'd be like, that's not enough data. You know what I mean? But it's what, it's what can be generated with the resources we have. And, depth for quantity.
Yeah, and I can speak to kind of like more maybe like some more like difficult areas to like adapt, like working with communities. And like we last semester, this one of the Scout Labs deliverables was to like kind of like reach out to community partners and kind of like interview them. So we spent the semester trying like doing a lot of research into like who can we reach out to and possibly partner with an interview. And we emailed them, but no, we like didn't really hear back from many community partners. So I think that also made me speak to like maybe the skepticism of like probably a mobile healthcare, but it was also that was like coming directly from like students. It wasn't coming directly from the clinic. So we kind of like reevaluated our approach and worked with Jessie clinic to try to have a better approach to that.
There was one question in the chat. I don't know if we got addressed that.
It's it's kind of tangential to this one. How did you approach working with communities to identify needs in a more participatory way? And then they close with, are they still involved? So I don't know who they, like if they is the community
Or
the Knox or the people who identified needs. But I guess the question is about needs identification and like, how did we know what to work on? And I think, part of it is, part of it came from the kind of beginning of this relationship with just, we have this van that Northeastern wants to deaccession. Who would like to have this van and can do something cool with it? And so I think that's really what kind of Kathy had been working with Knox for a long time beforehand. And so she was able to really make that connection. Do you want to talk
Actually,
about that?
Yeah, I want to be transparent. I had not been working with Knox for a long time. I mean, it was sort of, I had started at the Roux in 2022. They had joined us earlier in that year on that gap year program. And so, I think this is a really important lesson around, the realities of community engagement. Like I've been learning as I go. There are different personalities who are part of the leadership of the Knox Clinic. There are different dynamics with staff versus volunteers. So again, it's like we are definitely outsiders, and part of that process is like just staying humble and open and asking a lot of questions and keep showing up, because you got to just keep learning, like who can I ask for this, like we're trying to get some information, who's the least burdened staff person right now that I could go to. We want to write a grant with them, but I know such and such is really under a cloud right now because they're trying to get some other stuff, so I think right now our knowledge of community really is like the universe of the Knox Clinic. We know them pretty well at this point, but it's just I think it's really like an ongoing journey.
And with that, I think we're over time. So thank you, Kathy. Thank you, everyone online. Thank you for joining us in person. You can reach out to us after if you want to continue the conversation, but it was great to have you. Thank you again.